3 months last year, health services in public health facilities were not available. Doctors had downed their tools, demanding recognition, signing and the registration of the collective bargaining agreement of 2017. Their key issue was that they wanted better pay and better working conditions.
Of contention is the date of signing. What is of contention is the government itself, between the national government, the county government, agreeing, are they signing together?
And so they left the hospitals and went to the streets. A move that saw some of the Kenya medical practitioners and dentist union officials spend time in prison for contempt of court. 60 days after doctors had resumed work and signed a return-to-work agreement, the long-awaited and fought-for CBA was signed between doctors and the national government. Doctors in the lowest job grade will receive a minimum of 206,989 shillings and a maximum pay of 218,956 shillings, while those in the highest cadre will receive a gross minimum of 531,058 shillings and a maximum gross pay of 562,954 shillings. On the 6th of July 2017, each of the 47 counties signed a CBA with the Doctors' Union. Despite putting pen to paper to honour the agreement, the Council of Governors chairman and Turkana Governor Josphat Nanok admitted that the counties had no money to honour the CBA.
Our discussions together with the National Ministry of Health will be able to resolve this issue.
But before the ink could settle on the agreement, nurses went on strike and stayed away from duty for 5 months, paralysing health service delivery in public health facilities. A return-to-work agreement was later signed, bringing an end to the harrowing 8 months of devastation in the public health sector. But the nurses are set to wait a little longer for their CBA to be signed between the union and the county governments, following the disbandment of the Salaries and Remuneration Commission, SRC.
We still have a situation where nurses in state corporation are earning higher salaries, almost 3 times what their counterparts are earning within the county government and the national government. We will be signing a CPA that actually is going to foster disparities within the public service, and we cannot allow.
Nurses have also raised the patient-nurse ratio as one of the ills that have weakened healthcare provision in facilities. Case in point, the erroneous head surgery at the Kenyatta National Hospital that led to a wrong patient being operated on.
The particular case where those were 3 nurses on duty and 1 was in management, meaning that 2 of them were managing 60 patients, which means 130, another 130. When you look at WHO ratios, in a general ward where you don't have very sick patients, you need to have a ratio of 1 to 6.
Nonetheless, it was a win for nurses at the Kijabe and Moi Teaching and Referral Hospitals, after the Nurses' Union registered their first 2 CBAs ever since the inception of the nurses' umbrella body. As things begin to look up in the sector, it is the hope of the workforce that the public health sector will continue undergoing reforms in order to avert future industrial strikes.